Hello, and welcome to the HIMSS Media Social Media Debates. I'm your host, Beth Jones-Sanborn, Managing Editor of Healthcare Finance News. Now, to my right, we have Mr. John Lin, founder of HealthcareScene.com. Thank you for joining us today. And to my left, we have Shahid Shah, who is a publisher with Netspective Media. Thank you for joining us today. All right, so let's get right down to it. We'll start off with the topic that everybody's familiar with, and that's fire. You know, it's been very top of mind here at HIMSS 16, hearing a lot about it. Same as in HIMSS 15. So certainly at the top of the list. Does that surprise you that even here now at HIMSS 16, a year later, you're still hearing so much about this?
I think it's not a surprise because when you look at fire, it was really just the beginning at HIMSS 15. It was like, this is what's going to be possible. And I think CIOs now are starting to say, okay, well, you told me this would be possible. Is it really possible today? And where can I actually implement it? And unfortunately, I think even this year, that's still quite lacking. And so I think, you know, if we're not careful, CIOs are going to be burnt out on fire, not to use the pun, but you know, they're going to be burnt out and say, well, fire doesn't really do anything because what do I buy? What do I implement? What do I purchase? And so, you know, when they go to these vendors and say, oh, well, we're built on fire, and they say, okay, can I implement that tomorrow? Like, oh no, well, we're still testing. And so I think that's the fear that I have for fire, is that we're talking about it, but there's not enough actual implementations that are easily scalable across every healthcare system.
Shahid, where do you come down on this? What are you hearing?
I think the way to look at it is that it is a little bit of a surprise that there's still that much talk about it, especially when you see yesterday, for example, at the Venture Plus forum, Sansoro Health, which helps integrate EHRs using APIs, won basically best of show, right, in that particular category. Now, fire was as interesting as we think it is, you know, just from a talking perspective. A company like that wouldn't be necessary, right, because everybody would have implemented fire already, and you could just directly connect. Why do you need a middleware or a third party if fire was as far along as we think it is? Right. So it's not surprising that we're hearing about it. What's really surprising is that people are buying the hype, because if the hype were true, you wouldn't need to talk about it. You just go start doing it, right? And so in that respect, what we need to be careful about, that I do agree with John, is that, you know, be careful, because next year and the year after and the year after, it won't be, okay, it's nice that you have a talking point or a nice brochure about it, but where are your endpoints that you've turned on and are now starting to flow data through? Okay,
well, let's spring off of that. Where do you see this going?
Well, I think that's the problem with fires. As some of them have started to dig in, I think most of them see it as an evolution of the existing interoperability. Sure, it's faster, it's easier to implement. You know, there's some really nice benefits to fire, and we should do fire because it's much better than the previous HL7 standards and other interoperability options. But I think when they look at it, they're still saying, well, but it's still limited. I mean, last night I was driving back to the hotel with a CIO, and he said, I just want this done. Like, why have we not solved this interoperability problem? And certainly he wasn't looking to fire as like, oh, we've solved it, and you know, they just need to implement it, and then we're done. So I think, you know, it goes back to Shahid's point. There's like these entire companies that are focused on how do I get access to all of that data, and the CIOs want that. But you know, one challenge with that though is they're not pushing hard enough for it.
Okay. Shahid, let's go back to you. So how do you see this playing out? You know, are we still going to be hearing about this at HIMSS 17?
From a vendor perspective, you will be hearing about it, because on the vendor side, we need things to talk about, right? And so fire is a great thing to talk about because it gets people to booths and you have conversations. Ultimately, though, the big question about interoperability, and I got into a little bit of trouble yesterday because I said there is no interoperability crisis in healthcare, period. And what do we mean by that?
Right.
The crisis is not that we don't have tools and technologies available. Anybody who actually wants to build an API on top of any system today has more than enough open source. There's plenty of capability outside even healthcare that you can take packages, drop them in, and create your layers. How do we know that? Because we just saw a small startup called Sansoro Health win this yesterday. There's a company called MI7, Redox. There's a bunch of these companies that are already in place that know how to do this. Any one of the vendors here who are actually serious could pick up and buy any one of these small companies and implement this today. Our big crisis is in business interoperability. When two hospitals do not want to share data, they blame the vendor. When a hospital does not want to work with its suppliers, they blame the vendors, and it's a nice thing to do, right? Hey, I would love to share data from you. All of this duplicate testing and other things, I really, really want to fix that, but my vendor won't let me do it. In reality, everybody's waste, everybody's duplication, that's someone's revenue. If that revenue isn't being filled somewhere else, all the interoperability discussions in the world are not going to help because it's not a technology problem. So there is no data or technology interoperability crisis in healthcare. It is the business interoperability. How do we align two players in a market to work with each other?
Right.
That's our fundamental problem.
Well, let's have an interoperability discussion because, in our estimation, 90% of the vendors here are on board with this as a concept. So are we going to start seeing a shift? And by the way, the vendor, one of the 90% there is Epic, which is huge. So are we going to start seeing a shift with interoperability?
So I think the challenge is it's easy to say, yes, we're going to be interoperable, but the challenge in healthcare is that it's so complex that if you want an excuse to not do something, you can, right? So you say, yes, we want to be interoperable, but then push comes to shove, they can easily make an excuse, well, this happened and so that's why we aren't doing that, right? And so until the customers come to them and say, we want this to be in your system, they're not going to do it. Or they come to them in the RFP and say, you must do this, otherwise we're not going to buy you, we're going to go buy someone else. Then they'll start listening. Or here's another one, because I would argue against Shahid that there is a crisis of interoperability in healthcare. It's a patient crisis, because all of us as patients are suffering because there's not interoperability, because I go to one doctor, I pay for the fee for the radiology image, now I go to another one and I pay it again. And I'm exposed to all of those, harmful X-ray, things. And so I don't want to do that again, right? So for me as a patient, and for all of us as patients, it's a crisis for us. So if those patients could, somehow coalesce in a voice to help them understand that, hey, if you're not doing this, then you're harming us as patients, then that could change the needle as well.
Right, it's interesting because all we've heard about is how patients and consumerism are absolutely driving healthcare these days, so now they're even driving some of these underlying issues as well. Shahid, let's come over to you. Again, same question, with the interoperability pledge, 90% of vendors here, including Epic, on board. Are we going to see a shift or not?
You're not going to see a shift at all until we get the understanding that these pledges are being done by the wrong people. The pledges that we need, if it turns out that 90% of all healthcare providers in a single market did that pledge, it's believable.
Okay.
Getting national vendors to say we want to be interoperable, it's easy for them to say that. Every vendor already does HL7. They already know how to exchange data. They already know how to do interfaces. You have your companies like Iguana and CorePoint and others. We know how to do this. This is a solvable. It's been a solved problem for a long time.
They prove it every year in the HIMSS Interoperability Showcase, right?
Exactly.
They can do it.
We show it, we demonstrate it. This is not fiction. It is absolute fact. What is fiction is that we believe that through the pledges, we're going to get payers, providers, pharmacies, pharmaceutical companies, these multiple, very large, the trillions of dollars that we're talking about in healthcare spend, do not go to us here in these vendor spaces.
Right.
They go to providers, by payers, through employers, to pharmacies and to pharmaceutical companies.
Okay.
When they get together and say, we care about data interoperability, we care about aligning our incentives, then of course the vendors, because they're customers, as John said, when you put in an RFP that I require X, you get X. So buyers are in control in more areas than they think they are. Some of them don't believe they have enough control over their vendors, but they're buyers. They have the last ultimate item of control, which is the dollar bill or the check that they're going to sign. The pledges aren't actually going to do anything. So the patients are not going to be better off next year because of the pledge. No vendor is going to actually change anything in their roadmaps. That's how you tell, right? You pull up 10 vendors off the street and say, because of this pledge, show me your roadmap and what the features and functions. Where R&D dollar is going to be spent tomorrow that were not being spent yesterday. Yeah, then it might be real. But otherwise, probably not.
Okay. One of the things strictly on the observations here, the feedback that we're getting is that patient care, not as present in the conversations on the exhibit floor this year. Has that been your experience, and why do you think that is?
Yeah, so a number of people have said the patient's missing in the conversation. I mean, I even wrote an article talking about the patients and doctors are missing here. But unfortunately, I think some people twisted that in the wrong way. And they twisted it to say that these vendors don't care about the patient. And I think that's false. I think it is true we could do more to involve patients in the conference and things like that. But what's not true is that most of these vendors don't care about the patient. Now, they may execute it poorly, that's fine, we can argue those things, but they really do want to improve healthcare. They really do talk to patients. Could they do it more? Could they involve them in the design process? Absolutely, right? I mean, that could always be, but that's true for every business. Could you involve more customers in the design process? Absolutely. But to say that they don't care, I think gives them a bad rap, because they do care, but they're limited. They have limited resources trying to execute on a business model, and so they have to choose where to spend it.
Shahid, same question to you. Has it been your experience or the feedback you're getting that patient care not as much a part of the conversation on the floor as it should be?
Yeah, probably on the floor that's probably true. And the only disagreement I would have with John here is that, again, look at the roadmaps. The way you tell how much a vendor cares about something is you ask them about their product roadmap. So you go to the product manager and you say, can you give me your prioritized list of features and functions that you're going to put out? If it turns out that, say that you've got a company with an EHR, they have a back-end provider portal and they have a front-end patient portal. If it turns out that 99% of R&D dollars are being spent on the physician portal and 1% is being done on patient, I don't care what you're talking about. It doesn't matter how much you talk about it, how much you like them, how much you want to put them in your social media, etc. Because 99% of your R&D spend is in the place that is giving you the money.
Right.
Very few vendors on this floor here, some of them on the bottom floor do, but very few on this floor are being paid directly by patients. It makes absolute sense that they don't care is a bad way to say it. It is not their priority, right? They care. Everybody cares. No, I mean, you'd have to be heartless not to care.
Right.
But what they don't do is prioritize, and priority means here R&D dollars. How are you assigning them? How much are you assigning? And then goes to the point that John is making, which is very valid, is do you have them in your focus groups, in your patient portal, were patients designed or not? But I have very simple, again, as a mathematician or as a scientist, I say, where your dollars go tell you what your actual priorities are, because that budget tells you everything.
But to me, you kind of just proved the point, right? I mean, I talked to Patient Fusion in a discussion, actually it was MedFusion, and I was talking to them, and they said, when we started the company, we said it's all about the doctor because they're our customer. And they said we've seen a complete shift over the last couple of years where now it's all about how do we do the patient. And if we provide a great patient experience, then the doctor's going to care.
Okay, I have to cut you off there. Shahid, I'll let you answer that briefly in 15 seconds.
Yes.
Okay.
I love that example of MedFusion. They actually made an entire shift, because after coming out of Intuit Health, they became very, very consumer and patient focused. So that's a perfect example.
So there are examples.
Yeah, absolutely.
All right, well, John and Shahid, thank you so much for joining us for this installment of the HIMSS Social Media Debates. Thank you for joining us.